So what we're going to do for our first exercise is use Symbiotics Arthrometer to evaluate the subacromial space. We have a shoulder model here in the lateral position and the arthroscope in the posterior portal. So what we'll do is start by evaluating the subacromial space, and you can see how the scope has a 30-degree bevel, just like a standard arthroscope. And by rotating it, we can see the different areas. So the undersurface of the acromion is visible here. And then as we rotate laterally, we can see the top of the rotator cuff. We can back up and then go back, and across the medial side here is where we would find the AC joint. So it looks like we've got somewhat of a keel-shaped spur here. A V-shaped, like the keel on a sailboat. So we'll take the first tool, and we've got the probe on, and we've selected the probe, and we'll put it into the side. And as the probe comes in, we're able then to get a feel for some of the anatomy. So we can see the coracoacromial ligament here, and the edges of the acromion, and this is the lateral border. And then if we rotate our scope downward, we can see the top of the rotator cuff, and we can feel the top of the cuff like that. Now we're going to change and start our surgery. So we'll seat the tool in the holster, and we'll go up to the tool menu, and we'll choose an ablation wand. Now we have two buttons on our tool. So one button will be for ablation, and one will be for coagulation. And when we put the wand in position here, you see it's a 90-degree tip, just like we'd use in the operating room. And we'll start by just resecting the soft tissue, including the bursa and the coracoacromial ligament. We can use both ablation, and we can use coagulation if we like. And in our surgeries, we will typically remove most of the tissue all the way to the margins of the bones, from the undersurface of the anterior half of the acromion. It's important that we get all the way to the edge, because sometimes a spur will hide along the edge, or a osteophyte, and so we want to be able to see that. On the medial side here, it's important that we see the acromial and the clavicular facets, because that's how we measure our resection. So we always start the resection at the posterior edge of the AC joint, and then go from there anteriorly. So we've got most of the soft tissue off here, and we like to take quite a bit of it, because that'll minimize the bleeding that we will have. We'll leave a little bit so we can practice our bleeding. So see, we've got the soft tissue pretty well off there. Maybe I'll take a little bit more back here. You notice when I go out of the shoulder, out of the bursa, then I end up with an outside view, and that tells me that I'm off. So we'll go all the way along the lateral edge, see how we can do that. Okay, so that looks pretty good. Now what we'll do is change our tool, and we always holster the handle, and we'll choose a burr. And remember, the buttons then will have different function. We'll have suction, and we'll have the motor. And a lot of times I like to push them both together, because that'll allow me to keep a nice clean space. So we'll run the burr right along the lateral edge of the spur, and this will resect it all the way to the edge. And now we left a little soft tissue, so we expect that we'll get a little bleeding here, and maybe we won't. Okay, but so what we've done now is we've taken the lateral edge, And we can measure the thickness of how much we've resected by measuring against the thickness of the burr. So you see, depending on the measured thickness of the bone that we take off the pre-op x-ray on the what we call the ARTHRO, the outlet view, we're able to measure the thickness of the acromion, and we'll take just about half of that thickness off in a beveled fashion along the lateral edge. Now, to finish the subacromial decompression, we're going to put the camera in the lateral portal, and we're going to operate through the posterior portal with our burr. So we'll press the arrow once, and then that'll allow us to change, and we'll simply put the burring tool here in the posterior portal, and the camera in the front. And then that'll allow us to use our camera viewing from this lateral portal. So again, we'll go inside, we'll change our bevel to the correct position, and again, we'll survey the anatomy. Now what we find is the acromion is up here on the top, and we'll go in from the back with our burring tool. Now, what we want to do is start the resection from the back, beginning at the back edge of the AC joint, which is right there. So see, some of our spur goes back behind there. So we'll use the burr and the suction. And like I say, I like to use them both so we can get a good resection and good visualization. So as we go a little forward, we rotate a little bit, and well, we've got a bleeder there. So let's go ahead then and coagulate the bleeder. So we put our tool back in the holster. We'll get the ablation wand, and then we'll come out and view those bleeders. And so we can ablate like that along the lateral edge, and we can coagulate as well. And see, I like to be able to see that lateral edge. We can also go along the front edge here. We know that the coracoacromial ligament is likely to bleed up there. So we've got a pretty good look now at the anatomy. So let's change again. We'll holster the tool, get our burr again, and then go back inside. And what I like to do is undercut the front lip. And again, this will allow me to measure how much of this bone I'm going to remove. Now we're going to resect the facet of the AC joint. So that's the most medial boundary of the acromion, and we'll resect that. So well, we've got one more bleeder, so like in real life, we need to control that to keep our visualization pure. So we'll come in with our tool, and we'll ablate our bleeder. Okay, so let's look and see if we did a good job there. I always take a look down at the top of the rotator cuff from the lateral portal as well. It's really the best view you can possibly get. And then by rotating the arm in internal and external rotation and using your bevel on the scope, you're able to see all the way down the footprint, all the way to the back, all the way to the muscle tendon junction. So that's how we do a decompression.